Welcome to Health Fact 10M.
I've spent over 30 years working in emergency rooms, and I need you to really hear what I'm about to say. Most people over the age of 60 will not survive their first heart attack if they're alone. That's not fear, that's fact. Nearly half of all heart attack deaths happen before the patient ever reaches the hospital. Why? Because people lose precious time. They hesitate. They panic. They simply don't know the basic, life-saving steps that can keep blood flowing long enough for help to arrive. And here's the harsh truth. If you don't know what to do in those first few minutes, you might not make it. Every single day, I've watched patients wheeled into my ER who could have survived if they had just taken one or two simple actions at home. It starts with a crushing pain in the chest, shortness of breath, dizziness, or a sudden cold sweat, and by the time they reach us, that golden window of survival has already closed. But here's the good news. There are proven, science-backed techniques, simple actions that anyone can perform, even if you're completely alone, that can literally double your chances of surviving a heart attack. These aren't gimmicks or myths. These are real strategies that cardiologists teach their patients. In this video, I'll walk you through 7 life-saving tips every senior should know to survive a heart attack when nobody else is around. These are the very same steps I wish every patient in my ER had practiced before it was too late. And don't miss tip number 3, it's surprisingly powerful. Research shows it can mean the difference between permanent heart damage and walking out of the hospital alive. Most people have never heard of it, but after today, you will. All the scientific references and studies I mention are listed in the description below. Before we get started, I'd love to know, how old are you? Type it in the comments. I personally read and reply to every single one like we're talking in my clinic. So don't hold back. Now, let's get into it. Starting with number 7, the very first step that could determine whether you survive or not. Number 7, call emergency services immediately. The moment you feel symptoms, crushing chest pressure, shortness of breath, nausea, cold sweat, call emergency services right away. Do not wait. Do not second-guess yourself. Don't tell yourself, maybe it's just gas, or I'll wait and see. Every single minute you delay, more heart muscle dies. Cardiologists have a simple phrase for it: time is muscle. The longer blood flow stays blocked, the worse the damage, and the smaller your chance of survival. Research backs this up. The American Heart Association reports that patients who call for help within 5 to 10 minutes of their first symptoms have up to 50% higher survival odds than those who delay. But tragically, almost 1/3 of seniors wait more than 2 hours before calling for help, often because they don't want to bother anyone, or they think they can tough it out. That hesitation can be fatal. Picture this. A 68-year-old grandfather in Ohio feels pressure in his chest one evening. He assumes it's indigestion, drinks some water, and waits. Hours later, his daughter finds him unresponsive. Doctors later said that if he had called emergency services right away, he likely would have survived with minimal damage. That story repeats thousands of times every year, and it's preventable. So, if you're over 60 and ever feel chest pressure, breathlessness, nausea, or cold sweat, treat it like a heart attack until proven otherwise. Pick up the phone and call emergency services immediately. Even if it turns out to be indigestion, you've lost nothing. But if it's a heart attack, and it often is, you've just taken the single most important step to save your life. Recognizing the urgency and making that call is your first act of survival. But while you wait for paramedics, what you do next matters just as much. Number 6, chew an aspirin, if available and safe. After you call emergency services, the next move can literally mean life or death. Chew an aspirin, if you're not allergic and your doctor hasn't told you to avoid it. Aspirin isn't just a painkiller. It's one of the most powerful over-the-counter clot-fighting drugs available. Heart attacks happen when a blood clot blocks oxygen from reaching the heart muscle. Aspirin works by thinning your blood and preventing the clot from growing, keeping some flow moving until help arrives. A major study in The Lancet found that taking aspirin during a heart attack reduced the risk of death by 23%. But there's one catch: speed matters. Swallowing a pill whole can take 10 to 12 minutes to digest. Chewing it allows the medicine to absorb through your mouth and stomach lining almost instantly, within minutes. And when every second counts, that difference can save your life. A 70-year-old retired bus driver once told me his story. He was alone, felt chest pain, remembered his doctor's advice, grabbed an aspirin, chewed it, and called 911. Paramedics later said that single decision kept blood flowing just enough to prevent major heart damage. 2 weeks later, he walked out of the hospital, alive and independent. If you have no aspirin allergy, keep a small bottle of uncoated aspirin in an easy-to-reach place. Doctors generally recommend one full 325 mg tablet, chewed, at the first sign of a heart attack. Think of it as sending a rescue team to your heart while waiting for reinforcements. It won't stop the attack completely, but it can slow the damage and save your life. Number 5. Loosen tight clothing and sit upright. When a heart attack hits, Every movement affects how hard your heart has to work. One of the simplest, yet most overlooked, survival actions is to loosen tight clothing and sit upright. Tight belts, collars, or waistbands restrict blood flow and make it harder for oxygen to circulate when your body needs it most. Sitting upright relieves pressure on your lungs and diaphragm, helping you breathe easier and reducing strain on your heart. Lying flat forces the heart to work harder, especially if you have weak lungs or conditions like COPD. Research from the European Heart Journal confirms that sitting upright during cardiac distress helps prevent pulmonary congestion, that suffocating fluid buildup in the lungs. One 74-year-old woman in Florida felt chest pain while gardening. Instead of lying down, she sat upright, loosened her apron, and waited for the ambulance. Her doctor later told her that small decision probably prevented her from fainting, or worse. So if you ever feel those warning signs, sit upright, relax your shoulders, and free your chest and waist. Think of it as giving your heart room to breathe. Number 4. Cough strongly if you feel faint. It might sound odd, but if you feel dizzy or about to faint during a heart attack, coughing strongly can help keep blood flowing to your brain for a short time. This is sometimes called cough CPR. When you cough deeply, your chest muscles tighten, increasing pressure that pushes blood out of your heart and up to your brain, helping you stay conscious until help arrives. A study in the Journal of the American College of Cardiology showed that repeated strong coughing during certain heart rhythm problems kept patients conscious and maintained blood pressure temporarily. It's not a cure, but it can buy you valuable seconds. Imagine a 69-year-old man in Texas, alone in his workshop, who felt sudden dizziness. He remembered hearing about cough CPR, began coughing forcefully every few seconds, and stayed conscious until paramedics arrived. Doctors said those coughs may have saved him from brain damage. If your vision starts narrowing, or you feel faint, take a deep breath and cough hard every 2 to 3 seconds until the feeling passes or help arrives. Think of it as manually pumping your heart when it's struggling. Number 3. Unlock your door and keep your phone nearby. This tip is simple but often overlooked, and it can literally determine if rescuers reach you in time. Unlock your door and keep your phone within reach. Paramedics can break down a door if needed, but every extra minute wasted could cost your life. Studies show that for every 10 minutes of delay, survival drops by about 10%. One widower in Arizona called 911 but collapsed before unlocking his door. Paramedics arrived fast but had to force their way in. It was too late. Meanwhile, an 80-year-old woman in Florida unlocked her door, sat near the entryway, and kept her phone with her. Paramedics reached her instantly, and she survived with only minor damage. Keep your phone next to you at all times, especially if you live alone. Put it on speaker mode after calling 911 so you can follow instructions without lifting it. Your phone is your lifeline. Your unlocked door is the bridge that gets help to you faster. Together, they can save your life. Number 2. Take slow, deep breaths. In a heart attack, panic is your enemy. Fear floods your body with adrenaline, which spikes your heart rate and blood pressure, exactly what your heart doesn't need. The solution? Take slow, deep breaths. Deep breathing increases oxygen delivery and signals your nervous system to calm down. A study in the Journal of Cardiopulmonary Rehabilitation and Prevention found that slow, controlled breathing lowered heart rate and improved oxygen flow even in advanced heart disease patients. It won't stop the heart attack, but it buys time, precious time. Here's how. Place one hand on your stomach, inhale deeply through your nose, feel your belly rise, and exhale slowly through pursed lips, like blowing through a straw. Aim for about 6 to 8 breaths per minute. One 76-year-old retired nurse survived her heart attack using this very technique. Her doctor said those deep breaths likely kept her oxygen levels steady long enough for treatment to begin. Each calm breath buys your heart a few more beats, and that can make all the difference. Number 1. Stay as calm and still as possible. This is the single most important rule. Do not move around. Stay calm and still. Your first instinct might be to walk, stand, or shake it off, but every movement increases your heart's workload, and that can push it over the edge. A study in the European Heart Journal found that minimizing movement during an acute coronary episode reduces complications and improves survival. One 71-year-old farmer in Nebraska felt severe chest pain while working. He resisted the urge to move, called for help, and stayed still. Paramedics later told him that choice likely saved his life. Think of your heart like a fragile engine running on fumes. Every movement revs it harder and risks breaking it. Staying still conserves oxygen and prevents further damage. Repeat to yourself, I've called for help. My only job now is to stay still and breathe. That calm focus keeps you alive until the professionals take over. Closing message. These 7 steps form your survival map. You can't predict when a heart attack will strike, but you can prepare for it. Call for help immediately. Chew aspirin. Sit upright. Cough if you feel faint. Unlock your door. Breathe slowly. And most importantly, stay calm and still. Each of these actions buys you time, and in a heart attack, time is everything. A heart attack rarely gives second chances. But if you act fast, stay clear-headed, and follow these steps, you can survive, and live to see tomorrow. Now I'd love to hear from you. Where are you watching from? Do you keep aspirin or an emergency plan ready at home? Share your answer below. Your story might save someone else's life. Don't forget to like, share, and subscribe for more life-saving health advice. Stay safe, stay prepared, and remember, knowledge is power, especially after 60.
Your heart will thank you. Together, we can build a healthier America.